When parents first find out they're having a baby, they often learn about infant feeding to find an approach that is best for them. Here is an example of how a healthcare provider can find out what a family knows, build on existing knowledge, and assist them to find the accurate information that will support their values and beliefs to make their decision.
Good morning, Sarah. Hi, Alan. Nice to meet you both. My name's Audrey.
Good morning.
Morning.
Sarah, I see from your chart that you are 14 weeks pregnant. This will be the first in a series of appointments to check how you and your baby are growing. Dr. Brown will be in shortly, and after she sees you, I would like to review a few items and make sure that you have all the information you need for this point in your pregnancy. One topic I want to give you information on today is breastfeeding, since your body is already getting ready to make breast milk. How does that sound?
Sounds great.
Sounds good.
Do you have any questions or anything in particular you want covered in this appointment?
Not right now.
So we have covered most of the topics that we need to address today. I want to make sure that we have time to talk about your feeding plans for your baby. Have you thought about attending any prenatal or breastfeeding classes?
We are planning to register for prenatal classes, but right now we're not sure how we want to feed our baby after she's born.
Pregnancy is a good time to learn about your options. There's a lot of information out there, and classes can be a good way to get up-to-date information in one place. It's important that you get helpful information and make the decision that will be best for you, your baby, and your situation. Tell me a little bit about your thoughts related to how you might feed your baby.
Well, I would like to try breastfeeding. We've had many friends who have breastfed, some of them successfully for a long time and some not so much. We just don't want to put too much pressure on ourselves.
Thanks, Sarah, for sharing your thoughts. It sounds like you are concerned that if you decide to breastfeed, that you might not be successful. Did I hear that right?
That definitely is a concern for me. I do want to breastfeed because I know it's best for the baby's health and it costs less than formula, but I'm worried it might be difficult. Some of my friends who struggled went into breastfeeding thinking that it would be easy.
I understand why this might make you feel concerned. Alan, what do you think?
Well, I would really like Sarah to breastfeed, but I don't want her to get upset if it doesn't go well.
It's really great, Alan, that you are so supportive of Sarah. It's not uncommon for women to feel unsure about breastfeeding before they start. Are you okay if I provide you with some information that might be helpful?
Sure.
First of all, I need to tell you that my role as a healthcare provider is to support whatever decisions you make regarding the health and the care of your baby. Breastfeeding is the healthiest way to feed your baby and is recommended for almost all mothers and babies. Planning ahead can help breastfeeding get off to a good start. Also, there are many resources such as mother-to-mother breastfeeding support groups and healthcare providers with training to help mothers and babies overcome breastfeeding challenges. When you're considering breastfeeding, there are a few things you can do to get off to a good start. What kinds of things do you think you can do to be as prepared as possible for feeding your baby?
Well, I've done some reading about breastfeeding.
That is a great way to get started. We have a list of books and resources that you can access on our website if you're interested. You can check and see if the information that you read is similar to any of the information on the list. Anything else?
That'd be great, but I'm not sure what else I could be doing.
You mentioned you're going to register for prenatal classes. That's great. La Leche League is a support group that is specific to breastfeeding. Other parenting groups can be a good source of information and support as well. Our website also has information about La Leche League and breastfeeding education groups. I'll give you a card with the information before you leave.
What about formula feeding? What should I know about that?
That is a good question. It is rare that a mother or baby is unable to breastfeed for medical reasons. Formula is used to supplement breastfeeding occasionally due to medical concerns or when a family makes an informed decision to use formula. After your baby is born, if formula is being considered, talk with a healthcare provider who knows about formula and can help you learn to prepare, store, and feed your baby safely. Learning about formula is best done one-on-one with a healthcare provider, and that's why you don't learn about formula feeding in a class. It's important that you have information that is specific to your situation and baby. Formula feeding does have some risks for you and your baby. It is important to weigh out the risks and benefits. If you decide on formula, we can discuss ways to minimize the risks. If this is something you would like more information about now, I would be happy to talk to you about things to consider.
You mentioned risks of formula feeding. What do you mean by that?
Well, formula is manufactured food, and there are no natural antibodies like there are in breast milk to protect your baby. As with all foods and beverages, infant formula can be contaminated while being manufactured and is subject to product recalls. There can be a risk of contamination and challenges with proper preparation, feeding, and storage of formula. You can reduce the risks by making sure you understand how to prepare the formula correctly. Does that make sense?
It does. It's a lot to consider.
There is a lot to consider. I encourage you to continue this conversation together, and we can talk further about infant formula at your next appointment if you would like. You may also want to talk to some of your friends. Remember, it's early in your pregnancy and you have time to learn a lot about breastfeeding. Some families find it challenging in the beginning, but most mothers and babies are able to overcome any hurdles that they face. Your body is designed to breastfeed and your baby is equipped to breastfeed. Breastfeeding is how nature intended mammals to nourish their babies. Surround yourself with people who will support your decision. Feeding plans can sometimes change. It is important that you know who to talk to and where to get help and support. Do you have any other questions regarding what we have discussed today?
I don't think so.
Don't think so.
We've covered a lot of information, and there are some things to think about. Maybe write down any questions you have for our next meeting. Getting accurate information will help you feel more confident that you are making the right decision for your baby. We will see you many times during your pregnancy and chat more about your plans as your pregnancy progresses. If you have any questions, don't hesitate to bring them with you to your next appointment. Let me get you some of the resources we've discussed, and we will book your next appointment. I'll be right back.
Okay, great. Thanks for that.
When supporting a family to make an informed decision related to infant feeding, it's important to include the following. First, explore the situation. Encourage an open conversation. Explore the family's goals, as well as their values and preferences related to infant feeding. Work to support cultural preferences. Build on existing knowledge. Explore what the family already knows about infant feeding. Confirm information that's evidence-based and provide more information as needed. Approach the conversation in a non-judgmental way. Let the family know that you want to ensure that they have all the information they need to make a decision for their family, baby, and situation. Show empathy when the family is struggling with their decision, and assure them that you will support whatever decision they make. Confirm understanding. Use plain language and avoid using complicated medical terms. Encourage the family to be involved in the conversation by using open-ended questions, asking if clarification is needed, and offering an interpreter if you think that could be helpful. Determine additional needs. It's important that the family has all the information they need and know where to find more as they consider their options. Encourage the family to talk to each other and others who they feel will be helpful. Gathering information will help the family to make an informed decision. Identify next steps. Assist the family to clarify next steps and, if further discussion is needed, arrange for follow-up. In addition to these steps, it may be helpful to use a decision aid to assist the family and to discuss if they foresee any challenges that they may encounter during the decision-making process.